Hello, I'm Francesca Silman. I'm an ST3 in general practice working in North London, and I'm one of the founders of Just Health.
Hi, my name is Marie McVeigh. I'm a junior doctor working in London. I'm a GP trainee starting in August, and I'm one of the founders of Just Health.
We set up an independent judicial review because we were very inspired by how the lawyers had challenged the cuts that were made to legal aid by having multiple judicial reviews running at the same time. The BMA, we knew, were already doing a good judicial review on equality's impact assessment. We thought there were many other angles that affected patients, so we were concerned about patient safety, the impact on our patients of the contract changes, the impact on retention and recruitment of staff, and we wanted to look at these issues as well.
Junior doctors have been fighting against this contract that we have been expecting to be, very bad for the NHS and bad for doctors. The contract finally got published last week, so we've had a bit of a chance now to look at the detail of it, and it's as bad as we expected it to be, if not worse. We're very worried that if this contract comes in, it will be absolutely a disaster for the NHS. Over the last several months, we've been fighting this on the picket lines. We were fighting in the negotiating room. We've been fighting in the media. We've done everything we can to make our voice heard and to explain to the government that they need to stop the imposition. And so we feel that the legal option now is the last avenue left. So what we did was we set up a crowdfunding campaign through Crowd Justice, which is a website that people can donate on. And the reason we've done it that way, obviously, is because as junior doctors, we couldn't fund this ourselves. The BMA, our union, is already taking legal action and are going ahead with their own case. But we wanted to do this independently so that we could bring forward a much more broad case that took in all the different angles rather than just the equality angle. And the crowdfunding is absolutely key because we needed to raise the money quickly. It costs an awful lot of money, and it's a way for the public and our patients to show that they support us and to actually put some money in towards an action that they feel has a real chance of success.
Well, it's pretty amazing that in 4 days through crowdfunding we raised £100,000. It really shows how much the public are absolutely backing this campaign. We had over 4,000 individual donors. It went wild on social media. We had lots and lots of press coverage. So there's a real appetite to ensure and support the doctors are going to get a safe contract.
The contract was published last week, and now you've had a chance to see details of that. Jeremy Hunt has been saying that once junior doctors get a chance to see the details, you'll change your mind, you'll realise that he was right to impose it. How do you respond to that now you've seen the details?
Well, I'd like to say I'm very sorry, Jeremy, but I don't agree with you at all. The contract is actually even worse than we anticipated. The Department of Health's own documents state in their equality impact assessment that this contract is detrimental to women, single parents, carers, people who've been off sick, disabled doctors. It's absolutely outrageous in the 21st century that a contract is being designed that has these problems in it and is being accepted by this government. It's absolutely outrageous. So I'm afraid that no, we don't accept this at all.
I was actually shocked at how appalling this contract is. It was our worst fears imagined. I mean, one of the main issues with the contract is the equality impact. It's very, very clear this is going to hurt female doctors more, and we know that a lot of GPs are female doctors. It's also going to affect the recruitment onto acute specialties who are penalised through this contract. And most worryingly, the safeguards that have been in place to stop doctors working unsafe hours are completely being stripped away and pretty much being replaced with nothing. So,
obviously, this is the second 48-hour strike, the fourth strike in total so far. Do you think strikes are going to be able to win this? Do you think you're going to be able to beat the government on this one?
So strikes are part of a big campaign. So obviously we are talking a lot to the public, we're talking to the media, we're also talking to politicians, and the legal challenges are all part of a campaign. I think each individual element on its own is only a part of the puzzle, and what you need is that all coming together, and we're really starting to get everyone to understand what the issues are through the different approaches that are being taken.
Obviously, the next stage is the escalation that's going to include emergency doctors as well. Are you concerned that once that happens, you might start to lose the kind of public support that has been so important so far?
Well, I think when we explain to the public that this will be a consultant, senior-led service on that day, we will hopefully reassure them that it's going to be absolutely safe to go to hospital, that there will be doctors there, and in an emergency their care will be covered. It is important that we put more pressure on the government, and especially David Cameron, to end what is a crisis that's happening. This is very, very bad for the morale of the doctors. We don't want to be going on strike, and I think for the sake of everyone, we need this to be over, and we want to put as much pressure on them as possible, and hopefully, the government can back down. We're asking for two things. We're asking them to stop imposition and come back to negotiate, and then we can cancel the strikes. But we hope the public will understand why we're taking this action.
No doctor actually wants to go on strike. We all dedicated our careers and ourselves to medicine, to helping people and caring for our patients. And this is not something that any of us ever imagined we'd be doing. It's entirely the government's responsibility. The reason we're out here is because they're not listening to us and they've left us no choice. David Cameron has absolute power to end this whenever he likes. All he has to do is stop the imposition and return to negotiations, in a fair and professional manner, instead of threatening doctors and threatening the NHS. No doctor wants to strike, but we don't have a choice now. This is one of the only options left, and we're doing it for our patients and for the future of the NHS.